A breakthrough of genetic science could help transform the way diseases are detected and treated in St. Lucia, in what healthcare professionals described as a major step toward precision medicine. CariGenetics St. Lucia and Laboratory Services and Consultations Limited have launched a strategic partnership aimed at harnessing the power of genetics to improve diagnostics, strengthen cancer care, and uncover critical answers hidden within human DNA. The collaboration brings together the laboratory infrastructure of Laboratory Services and Consultations Limited with the genomic expertise of CariGenetics, creating new opportunities for advanced genetic testing, DNA sequencing, and precision diagnostics in St. Lucia. The initiative represents a significant leap forward for healthcare delivery, allowing medical professionals to better understand the genetic factors behind cancer and other chronic diseases, leading to earlier detection and more targeted treatment options.
From that moment, I went back into full-time research at the University of Oxford and was in the right place at the right time to come back and help in Bermuda for COVID. But one of the things that really stood out was I always wanted to bring research back to Bermuda, which is where I'm from. And as you know, with the pandemic, we all used to send samples down to Carver in Trinidad. And that's when I became really exposed to more of the Caribbean healthcare system, and that we were all in the same boat. We didn't have the capacity to tell which strain of the virus we were dealing with. That was genetic sequencing, which is what I used to do every day when I was in England. In addition to that, when the vaccine came out, there was a big hesitation of our people to take it. And the reason was they didn't feel like it had been tested on us to be sure it was safe, valid. And I was the bearer of the bad news that none of the medication we're taking has been tested to be safe on people like us. And the sheer fear in their face to know this really struck me. And that is when CariGenetics was birthed.
Chief Executive Officer of CariGenetics St. Lucia, Dr. Davy Frederick, said that the partnership was the potential to reshape healthcare by providing patients and doctors with deeper insights into disease risk and treatment pathways. While cancer remains a major focus, he says the technology could eventually support the management of a wide range of illnesses affecting people throughout the OECS.
When we started launching the program, Dr. Jules right away engaged us. He's like, young people doing this in the Caribbean, like we need to support this. So then we got support from the OECS. We had conversations with the Ministry of Health as well. But the reason I'm saying all this is because an idea I almost threw away because I thought it wasn't possible, was able to really grow and be able to build those connections. And through this introduction to Dr. Weldon, we were able to really push out the idea. We launched the St. Lucia's first prostate cancer study that same year, and the rest is history. So from there, the work continued to grow, and this is what led us to now rebranding. So Genentech Analytica is now CariGenetics St. Lucia. Proud to say that I'm the CEO of that company. And the partnership we're announcing today with Lab Services and Consultations is the outcome of this. Over the past year, this is not the first time we've worked together. Like I said, over the past year, we have been building a stronger foundation for genetics and precision medicine. One of our major achievements was St. Lucia's first prostate cancer study. We successfully recruited 157 men. And part of that study, each participant, they received a genetic wellness result.
Pathologist Dr. Stephen King noted that genetic testing is rapidly becoming one of the most powerful tools in modern medicine, helping doctors move beyond treating symptoms to understanding biological causes of disease. He said the partnership lays the groundwork for more personalized healthcare and could significantly improve outcomes for patients battling cancer and other complex conditions.
Cancer is one of the greatest health challenges. It's facing St. Lucia, the Caribbean, and indeed the world. Yet, despite this growing burden, we are living in such exciting times, transformative times in medical science. This is a time when science is making us or allowing us to understand cancer at its molecular level. I'm a pathologist. I look at slides and I see the morphology, breast cancer, colon cancer, etc. However, what the techniques nowadays allow us to do is identify the molecular characteristics of cancer, which is crucial for treatment, as you will see. We are today launching this partnership with CariGenetics St. Lucia. And we are also launching the genomic sequencing service in-house at Laboratory Services and Consultations Limited in this facility at Tapion Hospital. Through this partnership on genomic services, we have in the last 4 weeks, so while we have been waiting to launch, we have not been idle. We have actually tested 7 patients with aggressive cancers, and we have identified molecular targets that have advised on novel and effective treatment for 6 of these patients. 6 out of those 7 patients. Now the doctors have information where they can target the molecular defect, shall I say, or the molecular target in the cancer so we can give specific treatment. And that is how you save lives. Cancer is no longer a death sentence. Cancer is a disease that we can treat, a chronic disease that we can treat. There is hope.
By expanding access to cutting-edge genetic technology and building local expertise, the partnership aims to position St. Lucia at the forefront of healthcare innovation in the Eastern Caribbean, bringing the region one step closer to unlocking the genetic clues that could change the future of medicine. For 7TV News, Josiah Bisset reporting.